We improve the quality of life as independent as possible and helping them to reintegrate into society.
Hello everyone, welcome to See Fitness, your spot for faith, food and fitness.
So physiotherapy is a medical profession that focuses on maximizing movement in four spheres. So you have promotion, prevention, treatment, and rehabilitation. So included in patient care, you have the psychological, the physical, the social, and the emotional well-being of a patient being taken into consideration. So one, for promotion, we always promote the importance of physical activity and exercise. Two, prevention, a healthy lifestyle. So 150 minutes of moderate intensity exercise a week or 75 minutes of vigorous exercise a week for adults. So I usually encourage my patients to have a more well-balanced diet, to ensure that they're getting enough sunlight, to stick to a regular sleep cycle. We also help to prevent a decline in function of patients who are at risk for various dysfunctions. Treatment, we help to improve the quality of life. And we do this by helping to restore those body systems that are affected and will help to, impair physical functioning. Rehabilitation, so here we help patients to be as independent as possible and we help them to reintegrate into society. So their home, their work, their school, and recreational activities and other meaningful areas of their lives. Who do physiotherapists treat? Physiotherapists treat patients from the pediatric stage to the geriatric stage. We treat all age groups. Where can you find a physiotherapist? Are they only found in the hospitals? Do you think so? Nah. Physiotherapists can be found in private practices or clinics. They can be found working along with sports teams. They can be found in the hospitals, in nursing homes, in universities lecturing. They can be found in gyms, rehab centers, into the community, doing research. Now, what are some conditions that physiotherapists treat? I'm gonna start this list. I'm telling you, it could go on and on and on. Tendon repairs, arthritis, rehab after knee and hip replacement, back pain, sciatica, coronary artery disease and other heart conditions, rotator cuff injuries, spinal cord injuries, traumatic brain injuries, pneumonia.
A few moments later.
Parkinson's, Down syndrome, cerebral palsy, carpal tunnel syndrome, asthma, COPD, cystic fibrosis, osteogenesis imperfecta, lupus,
2 hours later.
scoliosis, pinched nerves, fractures, TMJ issues, those are issues of the jaw, frozen shoulders, rehab for ACL tear, dislocations of the shoulder and patella, for example. Okay guys, I'm just gonna stop right here. I'm just gonna cut it. But you get the point, yeah. Now we're moving on to 7 misconceptions about physiotherapy. Now this first one, it just grinds my gears. Physiotherapy is the same as massage therapy. No, it's not. No, it's not. But no sound didn't know say that. Biggest misconception ever. Massage is a soft tissue mobilization technique and it's used for muscle relaxation, which can bring about pain relief in different body areas. For me, I hardly ever need to do a massage on my patient. I always save it for last. So I do everything else first and it's not even in my mind now. It's not even in my mind, but it's just at the bottom of my list because I hardly ever need to use it, if you get what I'm saying. Depending on the diagnosis, some patients may need massage therapy, but this is mostly for musculoskeletal cases. If that's all the patient wants when they come into therapy, and I stress the wants, then it's best to just refer them to a massage therapist because some patients come with the expectation that, massage is all that they're gonna get. and they're gonna do nothing else, and it's gonna cure all their problems. And if they don't get massage, then they're not coming back. So for some patients, it's just best to, you know, I mean, of course, you'll explain the situation to them, you know, what physiotherapy is all about, just as I am doing here right now. But just refer them to a massage therapist, and you know those patients I'm talking about, right? Number 2, physiotherapy causes pain. And of course, this had to come at the top of the list. Now, listen and listen carefully. If you have pain, the goal of physical therapy is to reduce the level of pain that you're having. Having pain reduces movement, and lack of movement causes pain. This is something that I stress with my patients. You have to move. We were created to move. We weren't created to be still. It's either you're not moving properly because you have pain, or you have pain because you're not moving properly. So you as a patient have to have some level of trust towards your physiotherapist, trusting them that, you know, they know what they're doing, and they'll help you to work towards that goal of reducing your pain or increasing your function and mobility, so that your activities on a daily basis become easier. So in helping you to manage or treat your problem, it may cause some discomfort, but what we're doing is to help you to function better. Physiotherapy is all about pain management. If you're this far into the video, you would have picked up by now that could never be true, right? I mentioned some conditions earlier, so nope, we don't just treat pain. Swelling, balance impairments, we facilitate bone healing, we help people to walk again, we prescribe walking and mobility aids such as walkers, wheelchairs, crutches, canes. For those patients who lose their hand function due to stroke, nerve injury, broken bones, we teach them how to improve their function through the use of gripping exercise. We help them to perform self-care, so dressing themselves, combing their hair, bathing themselves, brushing their teeth, feeding themselves, and other self-care activities. We treat patients with cardiopulmonary problems. So for example, patients that are in ICU, we perform facilitatory techniques used to decrease their work of breathing, to mobilize secretions that may be pooling on the chest. We suction them, teach people how to cough, clear secretions, strengthen their respiratory muscle, and we teach breathing exercises, and these can be used to prevent lung collapse. Common conditions such as diabetes and hypertension, we play a key role in the management. So we help patients, we guide them with an exercise program. We also treat patients with lymphedema, we treat sports-related injuries, we treat women pre and post-pregnancy, amputees, wound care, and pelvic floor therapy as well. We also treat patients pre and post-surgery. So pre-surgery, we help them with strengthening and mobility exercises surrounding the area, so that rehab won't be as long as if they hadn't done therapy. Number 4, physiotherapy is a quick fix. So you can't just come physiotherapy one day and expect to be, you know, back to prior level of functioning. It doesn't work like that. So you have to be compliant with your exercises during your therapy session as well as at home. You have to ensure that your form when doing the exercises is correct. Follow the specific guidelines that are given for modifications of your daily performance when you're at work or at school or whatever you do for a living. Yeah. So once the patient is aware of the disease process, they'll understand that physiotherapy could never be a quick fix, and they won't get better in a day. If I see that my patient isn't progressing after some time, I have to go back, readjust the treatment plan, reset some goals, and see if the new approach works. If it doesn't, it is my job, it is my responsibility, it is my duty to seek other advice from my colleagues and or to refer the patient to other medical professionals for further testing and for other opinions. Number 5. Oh my gosh, physiotherapy is just exercise. I can do that at home, or I don't want to exercise because it's too much work. So physiotherapy is a holistic approach which involves patient education and the use of manual therapy as well. So there are things that we use our hands to do that you can't necessarily do on yourself. We use machines and devices as well that you more than likely don't have at home. Experts, guidelines and advice for you to follow during therapy and outside of therapy. And there's a reason why we went to school for that long, for however long. Some techniques are PNF, so it's basically a stretching and a contraction of the muscles to improve mobility as well as to improve function. Joint mobilization, this is used to improve the range as well as to decrease pain. This is basically gliding movements at the joints. Electrotherapy, so I know some of you may be familiar with TENS machine, and this machine is usually used for pain management. Electric muscle stimulation, traction machines, we use moist heat such as paraffin wax and heating pads, and as mentioned earlier, we do airway clearance techniques, so we do mechanical vibration and manual percussion, and this is usually done on the anterior and posterior aspects of the chest wall to help to mobilize the secretions. Almost finished, guys. We're at number 6. Physiotherapy and occupational therapy are not the same. Some of you may be hearing occupational therapy for the first time because just as physiotherapy is a small group of professionals, occupational therapy is an even smaller group. Physiotherapy generally focuses on the mobility and the function of the patient, so movement dysfunction and gross motor movements, The occupational therapist focuses more on the cognitive side of things and as well as specific activities that help the patient to integrate into their workspace, their school environment, or in their home. Physical therapists, personal trainers, chiropractors, they are 3 different professions. There are 3 different things, completely different. The years of training and certification differs, but some of what we do may overlap. A physiotherapist can do personal training, but a personal trainer can't do all of what a physiotherapist can do. A chiropractor now focuses more on like pain relief, spine alignment and adjustments, whereas a physiotherapist will focus mainly on pain-free movement. So it goes into the functional aspect of things. So the chiropractor will do more spinal manipulations. They may do stretches, but physiotherapist focuses more on the exercises and the stretches.
All right! Woo! Yeah!